I'm Prashant Kedia, Medical Director of Interventional Endoscopy at Methodist Dallas Medical Center. And I wanted to talk to you a little bit today about colon cancer screening and colon polyps. Um, you may get a lot of information from your primary care doctor about making sure that by the time you're around 45 to 50 years old that you're screened for colon cancer. And this is kind of a buzz point for healthcare maintenance and quality of care, just like getting a mammogram or a pap smear in females. But for both genders, around 45 to 50 years of age, it is a national quality guideline for them to get some form of colon cancer screening. The reason being is that colon cancer is a very common cancer in the United States, and it's preventable. It's preventable if you get a screening test early enough to detect precancerous lesions in the colon and have them removed. Colonoscopy has been the gold standard for looking in the colon and finding precancerous lesions. And these lesions start by the time that you're about 45 to 50 years old. About 20 to 30% of women and about 30 to 35% of men will have something called a polyp. A polyp is a little bump or growth inside of the colon that if you leave in there too long, number of years, can grow and turn into cancer. So by the time that people are about 45 to 50, 20 to 35% of the population will already have one of these precancerous growths. So the goal of a colonoscopy, which is a procedure, an outpatient procedure, which usually takes about 15 to 20 minutes to do, while the patient is under sedation, anesthesia, so they're very comfortable asleep. They don't really remember the procedure. But we look through the whole colon with the camera. And what we're looking for is identifying these little polyps, these little growths. And if we identify them, we actually remove them during the procedure itself, during the colonoscopy. By removing those polyps during your colonoscopy, that actually reduces your chance of ever developing or dying from colon cancer. So it's a very important and critical intervention that actually can improve health outcomes for many, many patients. There are the screening tests out there. Some of them are invasive or non-invasive, so there are a lot of stool tests out there that can detect polyps. And they are all considered approved by our national societies. But there are limitations to these stool tests. Many of them, all of them in fact, none of them are actually as sensitive as a colonoscopy. They don't detect as many cancers, they don't detect as many polyps, and you may miss things with a screening test that is just a stool test. So I think that the colonoscopy still is the best test out there. It's the most comprehensive. And if you're 45 to 50 years of age, this is something you should be looking into and asking your primary care doctor about seeing a gastroenterologist to make sure that you're screened for colon cancer. If you have more questions about this or would like to reach out to us, we're happy to deal with any questions or concerns you have and treat you for this thing and prevent you from ever getting colon cancer. Please reach out to our office if you have any questions. Thank you.